says.
All right, so we know that the health secretary certainly has not been shy about his belief that it's not about increased awareness. He thinks there are real other reasons for why this is happening, but let's take that out of it. What are your thoughts about just this increased focus on autism?
I think it's incredibly important that we're having a national dialogue and an expanded conversation about autism. However, advocacy efforts and policy decisions have to be rooted in science and fact, and it has to include the voices of the autism community, advocacy organizations, as well as industry and scientific experts. And we all need to collectively have a seat at the table in order to accurately represent the diversity and the depth of autism experiences across the spectrum. And that's where that added concern is lying, not only in the transparency about what this initiative will look like and what type of research is being carried out by who, but not being fully reflective of the needs and the diversity of the autism community.
Kristyn, you just pointed out something so important there, that the voices of the autism community have to be heard in all of this. Do you think those voices are being heard?
I think that there has been a really scary narrative that has been coming out of the administration surrounding autism. Using language like chronic disease or childhood disease or epidemic is not only inaccurate in the definition of autism, but it perpetuates stigma and stereotypes. I think it's important to note that behind every single one of these data points is a person, and they have value and strengths and challenges just like the rest of us. So reducing people to a data point and invalidating their experience is incredibly harmful. I do not believe that the full representation of the autism community has participated in these discussions. The Autism Society has continued to reiterate that we are willing and able to be part of these conversations. We want autistic voices and our peer organizations included, and that has not happened yet.
And my last question for you, Kristyn, we know that the health secretary is also asking the CDC to study a possible link between vaccines and autism. That comes, of course, despite strong evidence that vaccines do not cause autism. Do you think this should be re-examined?
No. There have been rigorous global peer-reviewed studies involving millions of people across the world that definitively validate that there is no link between autism and vaccines. So having our leaders that are making health policy decisions look at something that has already been discredited is not only an invaluable use of our time and investment efforts, but it delays the acknowledgement of the immediate needs of the autism community. I think it's important to note that while we're having this conversation about more research, there have been efforts to dismantle the existing supports and services that our community needs, and that includes the sweeping cuts to HHS, dismantling of the Department of Education, significant threats to Medicaid, which is a life-saving program for so many people in our community. And this is all taking away civil rights and supports that our entire community needs right now. So going backwards is really threatening decades of progress that we've made together.
And I only have about 15 seconds left, but with this increased awareness, with this increased focus, in an ideal world, Kristyn, what would the resources be going toward when it comes to the autism community, in your opinion?
I think that it needs to be evaluated across the spectrum. So we need to look at the diversity of experiences, the diversity of needs, and acknowledge that it is different for everybody. So there needs to be an investment in causes, understanding autism, as well as the treatments, interventions, and supports and services. So it's good we're having this conversation, but we have to demonstrate action and move forward together, remembering that we're more alike than we are different, and we should treat everyone with dignity and respect.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.